Chairman Castell, and thank you, representatives, for hearing this very long session and for sticking it out. I really respect you listening, and there's so many opinions, as I think Pamela just stated, and I'm here to really discuss some of those opinions in particular. So my name is Emma Hynes, and I'm here to speak, as Chairman said, against AB 337 on behalf of the Wisconsin Alliance for Women's Health. You've heard throughout the day the frightening statistics around teen pregnancies, STI rates, health disparities, and not least of which the economic costs of all of these health outcomes. I've chosen to focus my testimony on the sheer fact that parents, students, the faith community, healthcare professionals, and advocates simply do not want this bill. The previous speaker, again, I think it was Pamela, I'm sorry if I'm getting that wrong, but she said, you listen to your constituents, and as representatives, by definition, we're asking you to do that. So I'm just going to give you some statistics on what people think. So I can tell you that parents don't want this bill. 93% of parents of junior high school students and 91% of parents of high school students believe it is very or somewhat important to have sexuality education as part of the school curriculum. 95% of junior high school students and 93% of parents of high school students believe that birth control and other methods of preventing pregnancy are appropriate topics for sexuality education programs in schools. 88% of parents of junior high school students and 85% of parents of high school students believe information about how to use and where to get contraceptives is an appropriate topic for sexuality education programs in schools. 100% of parents of junior high school students and 98% of parents of high school students believe sexually transmitted diseases other than HIV/AIDS, such as herpes and gonorrhea, are appropriate topics for sexuality education programs in schools. Students don't want this bill, as we heard some of them today say. Students report that they want more, not less, information about sexual and reproductive health issues than they are receiving in school. Approximately half of students in grades 7 through 12 report needing more information about what to do in the event of rape or sexual assault, how to get tested for HIV and other STDs, factual information on HIV, AIDS, and other STDs, and how to talk with a partner about birth control and STDs. 2 and 5 also want more factual information on birth control, how to use and where to get it, and how to handle pressure to have sex. Yet a significant percentage report that these topics are not covered in depth in their most recent sexuality education course, or that they are not covered in sufficient depth. Teachers do not want this bill. More than 9 in 10 teachers believe that students should be taught about contraception, and half believe that contraception should be taught in grade 7 or earlier. Faith communities do not want this bill. Almost 9 in 10 self-described evangelical or born-again Christians support sexuality education being taught in schools. Over 4 in 5 pro-life or anti-choice voters agree that students should receive age-appropriate, medically accurate sexuality education beginning in the early grades and continuing through grade 12. More than 14 religious denominations and faith-based organizations are members of the National Coalition to Support Sexuality Education. Healthcare professionals and advocates do not want this bill. I'll list 12, though you know them well. American Academy of Pediatrics and Wisconsin chapter of the American Academy of Pediatrics, American College of Obstetricians and Gynecologists and Wisconsin's OB-GYNs, American Medical Association and the Wisconsin Medical Society, Wisconsin Academy of Family Physicians, American Public Health Association, and the Wisconsin Public Health Association National Campaign to Prevent Teen and Unplanned Pregnancy, National Education Association, National Medical Association, Wisconsin Association for Local Health Departments, Wisconsin Council on Children and Families, Wisconsin Coalition Against Domestic Violence, National School Boards Accreditation, Society for Adolescent Medicine, and of course the Wisconsin Alliance for Women's Health, who I'm representing today. These are formal statements. These are simply the ones who formally came out against AB 337, and they represent thousands of individuals, doctors, and public health advocates. There are only, I'll wrap up, there are only 4 that support this: Pro-Life Wisconsin, Wisconsin Right to Life, Family Action Council, and the Catholic Conference. If you support the bill, you accept the argument from the very few, very extreme groups that stood in the way of preventing rape victims from getting the compassionate and comprehensive care they deserve. They opposed including contraception as preventive medicine. These groups do not believe in condoms, and they've vilified family planning providers who provide primary health care to thousands of women in need throughout Wisconsin. I don't know where we lost the common ground, my last sentence. Thank you, Chairman. But I truly hope that you can listen to these constituents that I have listed. They represent Wisconsinites, they represent your districts. Thank you very much.
Thank you for your testimony. In your testimony, you mentioned quite a number of groups that oppose the bill. What is it that you believe the bill does that causes them to oppose it?
I can't speak for all of those organizations, obviously, but I can say from the Wisconsin Alliance for Women's Health perspective, I think those organizations are signing on for a lot of reasons, but just a couple, are that it's important that youth get medically accurate information. The concern is that moving this direction removes the probability of that happening.
How?
Because it's possible that they can now move to an abstinence-only choice.
Okay. Would that be better or worse than no program at all? Because under current law, we very likely are forcing districts' hand, giving them only the option of our way or none at all, to offer nothing. And there's no conversation that's going on.
Right, and I think that decision was made very intentionally by the authors of the Healthy Youth Act in order to force the hand and say, if you want to offer sexual health, it needs to be medically accurate.
Do you mind if some people disagree with you on that, on whether that's a good idea?
On medical accuracy?
Yeah. You could just say yes or no.
I don't think I understand the question. Who disagrees on medical accuracy?
Well, there's a matter of opinion of whether or not that was good judgment. And for many people's view, it probably was poor judgment to create that kind of ultimatum and mandate. In my experience, my experience tells me that was bad for a lot of kids. So I guess I'm not wanting to have an argument, but trying to bring out the fact that the current law isn't ideal in a lot of people's minds, and probably we could look down the road sometime into the future and find that we might have made a mistake had we not changed it.
Was that a question?
You're welcome to respond.
Well, I can't speak to the future of mistakes, but I can tell you that all evidence to date, excluding the one analysis that has been brought up today, which is, by the way, the first of, I wrote this down, I looked this up because I was fascinated by this, but it is the first randomized control study to demonstrate that abstinence-only intervention reduced the percentage of adolescents who reported any sexual intercourse, the first of thousands. So to say, as you said, maybe in the future we'll think of this as a mistake, I don't think that is likely. Clearly, I can't predict the future, but the likeliness of that is very slim, considering this is the first of thousands. And to speak to that study, it was only 662 African Americans in grades 6 and 7. Really quickly, I really just want to make this point.
I'm going to stop you because what's happening is we keep going down this road of making the assumption or the statement, in fact, that this is an abstinence-only bill. And it's not. It's just not.
But would you agree that it increases the likelihood of more abstinence-only education?
Based on the testimony I've heard from students today who attended programs all across the state who were very happy with the programming they had because it was very comprehensive, probably not. Because all of those programs existed prior to the current mandate. I even heard one student testify yet today, we've had a number, and I haven't heard anyone else provide evidence that there's a deficient program prior to the current mandate.
All of those students that you heard today were testifying against this bill.
But they were testifying that they were very happy with the program they had in their own school district.
Which were comprehensive programs.
Exactly. Without the mandate.
Right, so they were testifying that that comprehensive program works for them. So, I mean, why are we allowing for the option to go for abstinence only?
Because those programs are created without the mandate. So there's no evidence to suggest that there was a proliferation of one-dimensional programs, is what I'm saying.
Well, if you're taking just today's testimony as evidence, there have been 3 students, I believe, who've spoken. So they don't represent, obviously, all of the state.
Okay, thank you very much. Anyone else? Thank you for your testimony.
Thank you for coming today. At the beginning, you rattled off all kinds of statistics, and forgive me if I couldn't keep up. You talk faster than my daughters. But in there, correct me if I'm wrong, I think you gave a number of percentages, and you followed that up by saying that these are people that do not want this bill. Did I hear that correctly?
They were statistics about people who support comprehensive.
Okay, but then you followed that up by saying these are people that do not want this bill.
I did, yes.
I don't believe that those are statistics you used that were actually based on this bill. Were those statistics of people who were asked about this bill?
No, unfortunately there hasn't been comprehensive polling on this bill.
So you're taking a bit of a leap of faith there to say that these people do not support this bill, correct?
Sure.
All right. Now, I'll give you some more statistics here because this book was given to all these members today, and I've just been kind of scanning through it because I just got it yesterday. And so if I'm wrong, I suspect you'll probably tell me. But there are all sorts of evidences in here. You said there's only one study, and I believe that's the GEMET study, right, you're referring to?
Correct.
And that's in here. But it follows up with many others that have shown statistical evidence of abstinence-centered successes nationwide across all demographic studies. And just for another poll or survey here, the book also states a 2007 Zogby survey that showed that parents by a 2-to-1 margin preferred abstinence-centered sex education over comprehensive. It also states that 66% of parents think that the importance of the wait to have sex message ends up being lost when programs demonstrate and encourage the use of contraception. Now that's the opinion poll of the parents. So, and that wasn't based on this bill. Okay, that's just the general question on it. So that was a statement I wanted to make on that. If you have any response to that, I'd be happy to hear it.
Sure. So what I said was that the GEMET study is the first randomized controlled trial. Again, as you said, you're talking about a poll of parents, and I don't have that book, and I don't know what year you said that was.
I can get you one.
Okay, I'd love to see it. But this is the first randomized control study, which is, I don't know the exact definition of medically accurate, but that's the ideal, is a randomized control study. So this is the first one that theoretically shows medical accuracy, and I have a number of ways I'd love to refute that study, but I don't think the chairman would love me to do that right now. So we can talk about that afterward if you'd like, but I don't know that a poll can really be used as medical evidence in that way. That would be my response.